Welcome to the Small Business Voice with Justin Duncan and Jeanette Forney on Power Talk 1360 KFIV and the iHeartRadio app. We're here Saturdays to highlight local entrepreneurs and small business owners and to learn how they succeed to build their business from the ground up. What are their challenges and what are their victories? Jeanette, good morning. How are you this morning?
Oh, good morning. I'm looking forward to today's guest.
Yeah, today's show we have Dr. Erin Kiesel. She is representing St. Luke's Family Practice.
It's right in Modesto, right?
In Modesto, yeah. They are a nonprofit, and from what I understand, just from talking with them, they help the uninsured.
Well, I always wonder how nonprofits work. And I mean, being self-employed, since we are a business, also small business view, my view as being self-employed is insurance is too expensive. And I wish I could cover my employees. And yet at the same time, nonprofit, you end up getting this whole clinic vibe. So I have a lot of questions for her. I've heard some good things, but I know very little. So as usual, I'm going to have 1,000 questions. And I hope, hopefully, I will get the questions, answered that I have so that our audience also finds out more about the services they provide. And as a small business owner, if it's something that we can use.
So, Jeanette, tell me about the insurance world really quick. So what's going on? What's new? How are you helping people? I heard a rumor. Maybe you could address this rumor. I heard that insurance companies now are using drones to go around houses.
Oh, yeah. Okay, so one of the main things that determines a homeowner's insurance is the roof.
Okay.
And because of wind, storms, everything else, this is what's going to cause damage to a house, and also not having the repair on the roof. So when it used to be a home inspection, you'd see that like a creepy guy across the street, and he's got this camera, and you're going like, what's he doing? And you're running out there, right, with a shovel. And he's going, no, house inspection, I'm just going to take a picture. But now what they do, because of drone technology, they do drones because guess what? They now get the picture of the backyard, they get the picture of the roof, and they can say, their pool is drained. That's a big hazard. Oh, they have debris. Oh, we see this old car that they're working on in the backyard. That's a hazard. Or they have a trampoline. Mm-hmm. And so drones, they might be invasive, but after all, the insurance companies are trying to assess the risk of what they are insuring. So, and most of the time, it doesn't disqualify someone. They basically tell them, hey, you got to get the stuff cleaned up.
Okay, so that's good to know because, you hear rumors and you hear, like I heard that the homeowner's insurance was getting canceled because the roof was dirty. And this is in San Francisco. This isn't here.
Well, do you know what? I'm finding that a lot of the insurance companies right now, I wouldn't say it, but a lot of them are finding reasons to not insure. And even though we're still able to insure for the first time in 10 years, I actually had to give a quote on a fourplex. Mm-hmm. That was through the California Fair Plan. And it wasn't that there was something wrong with it. It was every insurance company, and I know a lot of insurance people out there, we quoted it, and they're coming, we've met our quota for that area. So insurance companies have put quotas on how many homes that they're willing to insure in certain areas. And so it's getting tough out there. But I mean, I've never had to do a homeowners or this is a rental, fourplex with a California Fair Plan. Yeah. I mean, they got good coverage, everything else, including vandalism. They ended up getting, loss of their income if something happened to the home. But they can't get the liability portion. Yeah. And it wasn't that bad, but also a customer called me up in Copperopolis. They are paying $12,000 a year for the California Fair Plan.
$12,000 a year?
$12,000 a year, and nobody will touch them. So right now I'm looking because most of the time with the California Fair Plan is you get your insurance, homeowners insurance, but if you're in a fire area or something like this, you have to add on the California Fair Plan. The house burns down from a kitchen fire, your regular insurance takes care of it. Wildfire, if you don't have California Fair Plan, then your insurance is not going to take care of it.
You're listening to the Small Business Voice with Justin Duncan and Jeanette Forney on Power Talk 1360 KFIV. Jen can see the frustration in my face.
I know.
Yeah.
You should see the frustration in mine, okay?
So I offer Legal Shield services. I believe that people should have a Legal Shield. Jeanette, we need to get together because I wanted to actually cover group benefits with you and your staff, when the time allows. And I figured I'd just bring it up now on the show, just put you on the spot. So,
Well, that's why I'm so interested in our guest today.
Yeah.
Because, I mean, that's something that's very hard to provide for employees. It's so expensive.
Yeah, it is. Yeah.
And you want to be able to provide as much as possible for your employees so that you give them those extra benefits.
Well, especially if there's no cost to the employer, too. So that's a benefit. So the value of Legal Shield for individuals, families, and small businesses is we never know what tomorrow's going to bring. If you don't have to worry about a bill, would you pick up a phone and call the expert attorney? Would you?
Well, yeah.
Yeah, okay. So that's what Legal Shield does all across the USA for 52 years, turning wrongs into rights. Because everybody deserves access to justice. Most people are priced out of having legal representation, but we got Joe back. Ask yourself, how much does it cost to talk to a lawyer? Do you know how much it costs?
Yeah, I know exactly how much it costs.
Yeah.
I have 3 of them on payroll.
Yeah, so with Legal Shield, the basic membership, it costs 12.5 cents per hour to talk to a lawyer.
Lawyers are about $900 an hour.
Yeah. So with Legal Shield for the regular person, so for me, I actually have a business supplement. I have a little bit more, but for the everyday person that has a job, if you need legal help, whether like you want to get your will done, if you want to dispute a traffic ticket, you name it, they're there. And if it's a service they don't cover, because we don't cover everything, they offer a 25% discount.
Okay.
Yeah.
All right. Sounds good.
Yes. So we will talk soon because I just like putting you on the spot.
Which you always do, but
that's I know.
Yeah, I'm thinking should have probably, I took a test once, to see what maybe different careers, and they said, you know what, you qualified for like law school, so should have got my law degree.
You know what, you would be a good lawyer, actually.
My father was an attorney.
Was he really? Oh, okay.
And so when you grow up with, he was an attorney, and then he did tax law, international tax law.
Yeah.
So, between taxes and then self-employment, he was self-employed, which I think probably like my mom, they had just gotten married. He was working for one of the largest firms in in Sweden.
Yeah.
When he decided to be self-employed.
Oh, wow. Well, so lawyers can do that, though, pretty easily now because they just open up.
But in a totally different field.
Yeah, I know. You told me like what he did. Like sometimes it was like a feast, and other times it was famine.
Yeah, self-employment, feast or famine. Mm-hmm.
Yeah, you know what we should do, you and I,
what?
is create a mock trial, and you and I go back and forth, and
I'd win. Well, I'm a good. My personality type is a great salesman.
Yeah,
and part of being a great salesman is overcoming objections. And so, it's like there's nothing you can't throw at me without me coming right back at you.
Yeah, maybe I'll find somebody else to take my place. Maybe I'll be like a legal clerk or something. Yeah. So anyway, we have Dr. Erin Kiesel coming on next. She is with St. Luke's Family Practice, and their phone number is 209-549-1057. And their website is St. Luke's FP Family Practice, or stands for familypractice.org. So, Jeanette, I'm sure you have a lot of questions for them.
I have tons of questions. I mean, not being able to afford having 7 children, but one thing I did find out was, which I'm going to tell her, is basically paying cash. You get in right away to see a doctor. And friends of mine that had insurance, they had to go through all of these. No, you can't see a specialist. You first have to see this one. But I was able to, I had a great pediatrician, Dr. Lunat in Manteca, those that know him. And I could call up and they'd know that we were paying cash. So it was like, can you bring your child in the next half hour? And so it was no paperwork, and everything that the doctor wanted to do, he could do. He says, these are the tests I'm running.
Yeah.
They don't have to get it pre-approved. So I'm looking forward to see what kind of practice she has and who she actually sees. I mean, I have preconceived ideas when we hear about these type of things. And so let's find out from her herself.
So she is waiting to come in. So we will get to Dr. Erin Kiesel next segment from St. Luke's Family Practice. Stay with us on Power Talk 1360 KFIV. Here we go. Welcome back to the Small Business Voice with Justin Duncan and Jeanette Forney on Power Talk 1360 KFIV. Reach out to us for more information on our featured guests by texting 209-896-6500, or you can always email us at info@smallbusinessvoicemedia.com. Today we have Dr. Erin Kiesel. She is representing St. Luke's Family Practice, and we were talking off air. I just want to say that when we were talking, it kind of brought me down memory lane. So Dr. Pickle, who we were talking about, it was my mom's doctor way back in the late 90s, early 2000s. And then Dr. Heck, who you still work with.
Yes.
He delivered my son. So, yeah, so it was just kind of cool just to kind of like, names I haven't heard in a long time. And you never, I mean, for me, it's like, you don't forget who brought your son into the world.
That's right. Yeah. A lot of us are still Valley people. Yeah. I grew up here and I left to go to school, and then I came back and practiced here. Yeah.
Okay, so where did you grow up?
In Modesto.
In Modesto. Okay, and you went off to school where?
I went off to Santa Clara University in the Bay Area, and then I went to medical school in Chicago.
Okay, but you did your residency?
Training here in Modesto at the Stanislaus Family Medicine Residency Program, which is what it was called back in the 90s.
Okay.
Which is what you're remembering from Dr. Heck being around. It's now called Valley Consortium for Medical Education. So it's kind of gone through a couple name changes.
Oh, okay.
Now, did you go through stay on the same path? Because, I mean, I've had friends, they've started medical school wanting to go in one direction, and then they find a love somewhere else, and then they go in a different direction. I mean, this is like family practice, like infants to elderly. And what got you involved with this? I mean, was this always your plan, or?
It wasn't maybe 100% always my plan, but once I started medical school, it was pretty much what I was set on. I loved everything. When you're in medical school, you rotate through everything, you see everything. And each rotation I was on, I liked. And so I thought, well, where can I do everything? Where can I see all ages? Where can I do procedures? Where can I do medicine with all ages? And family medicine was it. And you can specialize a little bit in family medicine if you want to. People do, sports medicine, or we'll do more OB, kind of like Dr. Heck did for a while. And then some of us stay really broad in general and take care of all ages. And
so there's only 2 doctors at, is it a medical facility, or would you call it a clinic? Because you are a nonprofit, correct?
Correct. We're a nonprofit. We're an office, I would say. Dr. Bob Forrester and Dr. R.J. Heck started the practice 20 years ago. They both came out of residency. They were physicians in private practices individually in town. And as Dr. Forrester tells it, he was hiking one day in Lake Tahoe and at the top of a mountain, and this idea just came to him that he actually never planned on doing himself. He thought, I have this idea. I want to offer really, really good quality care to patients, spend a long time with them, not have a lot of interference by insurance companies and this and that. But I also really have this yearning to take care of the underserved, which at the time he wasn't really doing. So he thought, I'm going to kind of come up with this Robin Hood model, as he called it. You know what I mean? Half of the patients are going to pay, and half of the patients are going to get free care. And one is funding the other is how it works, more or less.
So that's interesting because, when I said, nonprofit, are you a clinic, and things like this, that's the idea we get in our heads. But I am self-employed, and 7 children. My husband was self-employed. Never had any health care insurance at all. Every pregnancy paid for cash, made monthly payments up until the delivery date. And so it's interesting that you're saying that, in your practice, that it's not only those that don't have anything, but, not having insurance is sometimes just can be a choice. I mean, insurance was so expensive, 7 children, self-employed. And I think that if we would have just been paying just the premium that they wanted to charge us back then, which was not much, it still came to more money each year that I maybe needed for clothing and things like this than when we actually just try to stay healthy and would pay cash when something happened. We had a great pediatrician, Dr. Lunat in Manteca, and he retired. But so it's really interesting. So as a business owner, someone that's always paid cash, how does that work? Can anyone call up if they don't have insurance and say, tell you what, I'm not feeling well. what would a visit cost me to come in? Is it kind of like the urgent care where, it's $150, come in, we'll write your prescription.
No, essentially how it works is half of the practice does pay an annual fee, and they pay this fee. They usually still carry catastrophic coverage. So they may have a high deductible PPO, for example, that'll cover hospitalizations, labs, x-rays, specialists, et cetera. But the money that they're paying is for pretty unlimited access to us. So they have our cell phone numbers. We offer basically same day, next day visits, much longer visits. And the insurance companies are pretty much cut out. We don't bill any insurance. We collect from no insurance.
Oh, that makes it easier.
It does.
Yeah.
And so then the other half of the practice, though, are people who do not qualify for anything. They don't qualify for governmental programs or anything else. And so,
who would those people be?
So interestingly, it's not exactly everybody you think. Sometimes it's people that are new to this country, new immigrants that, for example, may be trying to get on Medi-Cal, but there's a waiting period. Some of them actually work, and so they're not making enough. They make too much money to qualify for any kind of a program, so they don't. They're unable to afford, for example, the Affordable Care Act insurance.
Yeah.
But they don't qualify for anything else. We get a lot of students.
I was going to say students.
Yeah, JC, Stan State. You fall off your parents' insurance. People that have been laid off during the pandemic. We had a lot of people come in that had been laid off from their jobs, and they just didn't have coverage anymore.
Do you advertise? Because my office is right down the street on Monte Vista from Stan State. And even some of my, clients that have come in, they've been students, and they'll say, I was really, really sick, but I don't have health insurance. And so I'm wondering, does the university know that students, if they call the office there at the university, health services or whatever, that they go, hey, you know what? There's a nonprofit in Modesto.
We try to keep in contact with the schools, with Stan State. I do have some contacts there with MJC. But we do have to remind them. So frequently, Dr. Heck and I will go and we'll meet with the agencies, with the hospitals, with churches, with other organizations in town, just to remind them that we are here and we're here to help.
And that's why you're here, too.
You're listening to Small Business Voice with Justin Duncan and Jeanette Forney on Power Talk 1360 KFIV. And we have Dr. Erin Kiesel in with us. She works for St. Luke's Family Practice. The office number is 209-549-1057. Website is www.stlukesfbfamilypractice, it stands for .org.
He gave all of that information and everything else. Where is the practice located?
The practice is in McHenry Village. So we're in an office space across the parking lot from what was the old Rock and Jump. I think it's called something else now.
Oh, the trampoline place?
The trampoline place.
Okay.
And we share space with Sierra Vista. So you'll see our logo on the door, but Sierra Vista's is a little bigger.
And what are your hours?
8 to 5, Monday through Friday. We're officially closed on Wednesdays, though we will come and see people on an emergent basis. And Dr. Heck and I are available 24/7 to our member patients.
Yeah, and one of the things that I guess I really enjoyed by not having insurance, if I called, because they knew that, Mrs. Morney pays cash, if I called up, they'd say, can you come in the next half hour? Which was kind of like nice. Instead of, no, you have to put in something for your insurance company, it has to be approved, it's like, so that's one thing that I found. And so this was very refreshing to hear that now as an adult, because we always we take our kids when they're sick, and then the doctor would go like, yeah, I'm going to make a prescription for enough for the rest of the 6 because they're all going to get it. And so this is nice to hear. So you have plans, let's say, for someone self-employed or students. So I want to hear how these plans work, because this is fascinating to me as a business owner. And I know there are business owners out there. We don't have insurance.
No.
And the prices that they want to charge us is insane. I could hire another person for that. So,
well, I have insurance, but it's because I have a job.
Oh, yeah. See, there's the job, and then there are those that actually, have to make their own.
Yeah. But Jeanette's a godsend for me, so I don't throw that in her face too much.
All right, great.
All right, so we're going to come back with Dr. Erin Kiesel with St. Luke's Family Practice. The office can be reached at 209-549-1057, and the website is www.stlukesfb.org. So stay with us on Power Talk 1360 KFIV. Welcome back to the Small Business Voice with Justin Duncan and Jeanette Forney on Power Talk 1360 KFIV. Reach out to us for more information about our featured guests by texting 209-896-6500, or you can always email us at info@smallbusinessvoicemedia.com. You can pull up any of our past shows on the iHeart Radio app. Just search and follow the Small Business Voice. Like and follow us on Facebook, Instagram, X, TikTok, and YouTube. And my wonderful guest host is a fellow business owner, Jeanette Forney of Allstate Insurance. She's over in Turlock. You can call Jeanette at 209-667-2222 or email Jeanette at JeanetteForney@allstate.com. So we're back with Dr. Erin Kiesel of St. Luke's Family Practice. I believe you were probably my son's first pediatrician, if I had to guess, because it's so long ago. I mean, now we're talking, he's 24. He's going to be 25 in December, so it's been a while. But when I saw the Dr. Kiesel, I'm thinking, man, I know that name. So
Yes, I was at Houston for about 17 years, so starting in 2000, so it's quite possible.
Yeah. I'll have to talk to my ex-wife about that, because, it's just, because she always managed the pediatricians coming in and out, so, I always just kind of went along with it, which is my personality type. I just go along with Jeanette, so.
We did these personality tests a couple of weeks ago, and it was quite interesting how different our personalities are. And but when we finished up kind of like the last segment, and we were talking so much because I'm interested as a business owner, I have tried to see if I could be able to afford, let's say, health care for my entire staff. They're all women. They have children, some of them, and knowing that being a mom of 7, it was difficult being self-employed, having a husband that was a contractor. And so hearing that, and see, it was always the same thing. If it was a clinic, then you had to be able to be qualified for Medi-Cal. And then if it was, I actually, I'm pretty sure you say this, I'm going to get hate mail. But then at one point, I actually went with like this healthy families thing. And my daughter was extremely ill, my little girl. And she was so sick. And so when I called that number that they had given me, it was some clinic down like by the docks in Stockton, and they were only open one day a week. And the recording basically said, "We're out 8 weeks for appointments. Leave a message." I was like, then I took her down to like the emergency room, and I sat there for hours. And then finally I said, I'm just going to call my pediatrician, who said, "Come on in, Jeanette." And when he saw her, he goes, "Oh my God, she's really serious." But I mean, that's how broke we were at the time. Because when you're self-employed, sometimes it's feast or famine. I even grew up self-employed. And I did not know where to go. So now I can see, took your fellow doctor climbing up on a mountain, getting closer to God.
That's right.
Who said, you know what, you have a gift. And you have something to give. And this is what I want to do. So he opened up this family practice. And when did you join it?
I just joined about 6 years ago.
Okay.
So I've known Dr. Heck and Dr. Forster my whole training. They were both attendings of mine. And at the residency program, they were both teachers there. And a couple of times along the way, they tried to recruit me to the practice. But I was happy where I was. I worked.
And what made you, go over there? What happened?
After 17 years working in a system with a lot of insurance and a lot of bureaucracy, and finding that less of my family medicine skills were being used and more of my time was being spent on the computer and doing a lot of things that are now required of doctors that are not medical, I really began to get a little burnt out. And the direct primary care model, which is the model of St. Luke's, was really attractive to me. So there's no insurance involved.
Yeah. You can help people.
With either side of the practice, right? So we're helping people that do not qualify for anything, that are completely uninsured. The other side of the practice is paying an annual fee, but I really get to be their doctor. I mean, they can come in and see me, and they can schedule an hour appointment. I can sit with them for a whole hour and spend time and not only do their exam, but teaching and all.
And not being, let's say, hindered by what insurance company you have. I remember one of my daughters, who's now a pastry chef, she was so little. She had a hernia. And we had to get surgery. And so when the doctor came in and everything else, and he was telling us, okay, this is where this is going to be the hospital, this is going to be your anesthesiologist, this is going to be the doctor, et cetera, blah, 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 for the surgery. And he goes, you still do have a Blue Cross, don't you? And I said, no. And he's going, well, how are you paying? I said, it's going to be cash. And so then he says, oh, well, in that case. And it was like he ripped up the whole thing. He goes, this is the doctor you need to use. And we're switching to this hospital. And he goes, even though they charge for an hour, it should only take a half an hour. And when it comes to, she's so little, the one for the anesthesiologist, $500, cut her a check. She's the best one for infants. And it made me think, if I had insurance, I wasn't getting the best doctor. The doctor was confined to what the insurance, since when is the insurance company the doctor? Because this was my little baby girl going for surgery, and not until I was paying cash did I get the best doctor, the best hospital, and the best anesthesiologist.
Well, that makes sense, too. I never even knew that, but that makes sense. You know,
And so is that some of the frustration that you were doing more of the insurance instead of being able just to help people make decisions?
Right. And asking permission for everything that I felt in my clinical judgment needed to happen.
Yeah.
And an insurance company deciding, yes, we're going to let you do this, or no, we're not. And so, you know, having that taken away is really added to my joy as a practitioner of medicine. But I think it really is helpful to the patients, really to just be present for them. I mean, a lot of new patients I get, the reason that they've left their prior system, whether it be an office or a medical system, is that they feel like they're not heard. There's not enough time. They have to retell their story every time because a different doctor has seen them each time. And they are looking for something that's more old-fashioned, like the way it used to be, where you get to know your doctor. He or she knows your story. They know your kids. We know each other's kids.
Well, back in the day, you had house calls, too. You know,
and we do that.
Yeah.
We do house
you do
calls.
house calls.
Yes,
Wow.
we do.
Okay, this is a whole new thing.
So-
How far will you travel? I mean, that's what you even asked for a pizza delivery. How far?
Hold that thought. Okay. So you're listening to Small Business Voice with Justin Duncan and Jeanette Forney on Power Talk 1360 KFIV. And we have Dr. Erin Kiesel with St. Luke's Family Practice with us. The office number is 209-549-1057. Or you can go to their website, www.stlukesfb, stands for familypractice.org.
Okay, so I mean, now I have just so many more questions. All right, for house calls, when is it specific? I mean, I'll do house calls for insurance when it's an elderly woman, and we had someone that had her car stolen, was her only car, and so how was she going to sign the paperwork? So we drove up to her apartment, even though she was a young woman, and got the signatures and the paperwork. What ends up making that you would say, we're going to make a house call on this one? What are the cases?
So we have different levels of service that people end up paying for on the paying side of the practice. Some people are completely homebound, meaning that is all I do is go to them, either at their home, at a board and care home, or a care facility. But some of my other patients, for example, let's say a patient is hospitalized and has a hip replacement, and they need that incision checked, and they just can't get in the car and come over to the office. I definitely would go over and check on them. I've had some elderly people that had a kind of a nighttime emergency, called me in the middle of the night, were scared. I didn't want them driving, so I might go over to their house and check on them. Okay. I've had some families that have had an older patient at the end of life, and you're not going to put somebody in a car to the office when it's coming to the end of life. So I'll go and make a visit to the home for those kinds of things.
Right. And that's got to be miserable.
Okay, so now...
I mean, just that's that scenario right there.
So with this pay, like I'm self-employed, and I mean, you can either pay the insurance company and then have deductibles and paperwork, or you can stay healthy, which... Being born in Sweden with socialized medicine, that's all we did was stay healthy. But it sounds like you also might have a concierge type of service program for maybe professionals and that don't want to deal with those things. They're self-employed. We don't have to go to the doctor often. But you do have annual plans. Are these like annual plans for individuals or annual plans for families?
Yeah, we don't call ourselves concierge because we feel like that seems fancy.
But it is fancy. You do house calls.
It is. It's direct primary care is how we refer to it. And yes, we have plans. They're mostly individual, though, with the children. We'll usually charge the annual fee for the first maybe 2 children, and then children beyond that are free. So, we work with people in that regard.
So those people out there, 7 kids, hey, she's the one. Okay.
Well, yeah, I mean, it's good for people to know, because if I would have known, a long time ago with our kids, that might have been a better option. Especially with my son. My son had asthma really bad, and he dealt with it till probably about 10, years old before he finally got it under control. But he lives in San Francisco now, and he still carries around an inhaler, and he's on the Advair and all that. But his allergies are down over there. It just seems like if you have insurance, maybe still give you a look. Is that still
correct? Because if you have a high deductible, we work well with that. You pay the annual fee, but remember, we are a nonprofit. And so what we do is we keep an accounting in the office as if we were billing insurance, which we aren't. But at the end of the year, we give each patient an accounting of their services, and we use Medicare rates to just guess at what those might be worth. Mm-hmm. And so if the patient pays the annual fee and they only come in a few times, we take what they paid, minus that off. The rest of that is a donation.
Okay.
It's a write-off, a tax write-off. So,
now she's speaking my language.
So you're getting care for yourself, but you're also helping the community. You're helping this other group of people,
which I think is really great.
Yeah, and you get the perk of a tax write-off.
How much is the annual fee, if you don't mind me asking?
I should have memorized those. It depends on age.
Okay. And I mean the condition too. It's like, it's like I'm old. I'm very old, but I'm very healthy. And then you might have someone else. My sister's only 1 year apart from me, but she has an Easter basket full of.
Jeanette,
sorry.
29 is not old, by the way. So it depends on your age.
It depends on the age, and the prices are all listed right on the website, so that you can see. But it is based on age.
Okay.
But for that fee, it is unlimited visits, nights, weekends. You were mentioning your child that has asthma.
Yeah.
I have some asthmatics. The parents can call every single day and bring their kid every single day for the whole year if they want to, and that's included in that.
So do they set up an appointment, like, let's say for myself, would I set up an appointment to come in and talk about plans? Because, I have a 23-year-old daughter, very healthy, but she has no insurance. She's married to her husband who just got out of the Marine Corps. They have no money, so they're living with me. And then I have my 18-year-old son. Anything happens with my son, if he gets sick, but he's also very healthy. But I always end up, here's $150, urgent care center. So it would be nice if they had more of a relationship maybe with a doctor.
Sure. So our office manager does do phone, answers questions over the phone, but we also have free appointments to meet with either Dr. Heck or I. If people want to just come in we call it a meet and greet. It's a little bit of a silly name, but just to meet us and see, am I the kind of doctor you're interested in? Do you like the way I practice?
And what services, so when you talk about that meet and greet, what services do you have? Do you have x-rays available, or are you mainly for colds and... We are for urgent care things, but we're also for healthcare maintenance. We don't have x-ray in our office, but we have some other things like, we can do urinalysis, we can check sugars, we can do strep, COVID, we can do blood thinner checks. We have a lot of patients that are on blood thinners. We do a few vaccines. So we have those things available in the office, but we also, do annual physicals. I do pap smears, breast exams, women's health. We do small procedures, casting, splinting, stitches, trying to keep people out of the emergency room. I have an EKG machine. The football injuries.
Well, so I might have a referral for you, actually, because my dad, he's 75 and retired. Now, he does have the Medi-Cal, but my dad's... well, maybe this not be a good referral for you because my dad, he's hard to deal with sometimes. So, but if I could maybe send him to your practice, that might be a better thing for him. And then for me too. I have insurance, but would you say give you a look even though I haven't insurance?
I would say so. The best, like I said, the way it works best is people with PPOs that tend to be high deductible. That works best. HMOs that are affiliated with a certain organization like Kaiser or Sutter, that's an HMO that doesn't work as well because they require you to have...
They won't let you go and see a doctor of your choice.
Yeah.
We have a few people that do it, but it's more difficult for me because I can't order things for you and things like that. So the PPO side, high deductible, or Medicare patients with Medicare works great.
Okay. Yeah. All right. Mm-hmm. So,
all right. Well, I love the whole fact about don't use it. It's not like you lose it, but it ends up, it's going to a good cause and it becomes tax deductible if you stay healthy, but you do have something that you're contributing to just in case your child gets sick or cuts himself.
Correct. And and I think people can feel good that they really are helping the community.
Helping the community.
There's been innumerable examples of people that have come into us that haven't had care for whatever reason. We have diagnosed cancers, heart diseases, all sorts of things. We end up being able to connect those people sometimes with services, like get them on Medi-Cal once they find out they have something. But, they didn't know they had a melanoma that we did a biopsy of and diagnosed, or a malignant breast cancer.
Well, that's the main thing. When you don't have insurance, you don't go to the doctor. You go if something's broken. So, I mean, this has been such great information.
Yeah, I appreciate you coming on today.
Thank you for having me.
Yeah, our pleasure. If you are uninsured or, if you're looking for maybe a new doctor, you want to get rid of the bureaucracy out of medicine, I guess the best way of putting it, give St. Luke's a call. Their phone number is 209-549-1057, and their website is www.stlukesfbfamilypractice.org. And to redo that, just stluksfp.org, and the FB stands for Family Practice.
McHenry Village. That's what I'm going to remember.
Yeah, yes. McHenry Village.
McHenry Village, yep.
Yes. So, Dr. Kiesel, thank you again for coming in today. Thank you for your hard work, because when my son was young, I know that probably wasn't easy on you. And so,
no, thank you so much for having me. It's
we need
really
more
been
doctors like you.
Yes.
We need these kind of things. Well,
definitely. Dr. Forrester's idea was amazing, and I've been blessed to get to be part of it. Yep.
Yeah. Tell him thank you for us too.
I will.
All right. You're listening to the Small Business Voice on Power Talk 1360 KFIV. Stay with us.
Daydreaming about you all day long. Radio's been playing all our songs. Just read your message on my phone. It's turning me on when you say you need me.
This business tip is brought to you by CISPRO Innovation. I'm Catherine Ramos, and today we're talking about ongoing learning and improvements within your business. The business world is constantly changing. Stay informed about new trends and best practices. Regularly review and update your business strategies and operations based on new information or changes in the market. And remember, do not be afraid to train your replacement. That only means that you're moving on to bigger and better opportunities. CISPRO Innovation, where we help local businesses connect with local families. For more information on this tip, check out our blog at CISPROinnovation.com. That's CISPRO, SISBRO, innovation.com.
Welcome back to the Small Business Voice with Justin Duncan and Jeanette Forney on Power Talk 1360 KFIV. You can pull up any of our past shows on the iHeart app. Just search and follow the Small Business Voice. Reach out to us for information about our featured guests by texting 209-896-6500, or you can always email us at info@smallbusinessvoicemedia.com. Like and follow on Facebook, Instagram, X, TikTok, and YouTube, and connect with me on LinkedIn. And my wonderful guest host is a fellow small business owner, Jeanette Forney. She is an Allstate owner over on Monte Vista in Turlock. Call Jeanette at 209-667-2222 or email her at JeanetteForney@allstate.com.
That was incredible.
Oh, yeah.
I mean,
I thought you were calling me incredible, but yeah, you're right. That was a lot of information, and I'm glad we had her on.
And you know what? We could have gone on for hours, especially when, if you talk about a show of, where there's more harm sometimes from insurance companies, and to find a doctor that all they want to do is be able to help people. Yeah. And that's what doctors should be doing. A doctor should be spending their time treating patients, not doing paperwork, and not asking for permission if they need to run a test or having their hands tied.
Yeah, because a lot of times you want to go in and you have this going on, and you have to cut through the I'm going to say paperwork, but it's not. But that's not the word I wanted to use. But
or getting approvals before you can go to the next person, and the thing is, I was lucky, like I was talking about, having a great pediatrician. He's retired since. To know that there is somebody out there, especially for moms or for those young students, or like my daughter's 23. Where would she go? We have a place. We have a place to shout out now. So, exactly.
So this is great. So I'm excited. So Community Corner is proudly sponsored by Lightspeed Graphics, creative media agency specialized in video and animation. To get in touch with the owner, Kurt Gonzalez, simply text him at 209-617-2606 or visit his website at lightspeedgraphics.com. We have Gold Star referral clubs that happen Monday through Friday. Jeanette, you have the Tuesday morning at 7 a.m.
Tuesday mornings, My Garden Cafe in Turlock, and a great breakfast.
Yeah.
And we had probably about 15 business owners there this morning.
Nice.
And it's a great way to touch base. Yes, on Tuesdays, it is come there by 7 o'clock in the morning. And if you want to be my guest, I mean, I'll greet you at the door and I'll pay for your breakfast.
All right. So if I'm your guest, will you pay for my breakfast?
No, you're already a member.
Oh,
but you know what?
Yeah.
I'll pay for your breakfast.
Would you? Oh,
Yeah,
that's so
course.
nice of you.
So wait a minute. Where is your club so that I can get you to pay for my breakfast, right?
So for your lunch, so I'm paying for lunch now. So,
Oh, that's more expensive. Okay.
So I meet over at Skewers over on 9th and L Street, and they got the service there is excellent. The food there is excellent.
Mediterranean, right?
Yeah.
So it's healthy.
It is, yeah. Especially with I'm working with Rooted Movement, so like I'm showing my plate to Mari, every time. So I text her pictures, but anyway,
Yeah, how's that going?
It's going great.
Okay, good.
Yeah.
Okay, just
Yeah.
checking in with you.
Yeah. Well, so next week we're going to have Rick in from Rooted Movement. So
Then I'll really get. We're going to spill the tea on this, right?
yeah. So, but anyway, it's been going really good. I'm wearing pants now that I can fit into again. They're comfortable. So I can feel like I'm really losing inches. It might not reflect on the scale, but I can just feel like the inches, the energy's coming back.
Yeah, what
So-
you say, it's like when you start losing weight, get rid of any pants that have elastic.
Yeah. Well,
I used to have what's called wish me jeans. Wish jeans, those are the jeans you wish you could fit into. So you try them on and, you lay down, you ladies out there, you lay down on the bed and then you suck in and you try to, zip them up. Well, those are the jeans that you buy. And then you try them on every other day and it just keeps you, in focused.
Yeah.
And then one day you're able to fit into those jeans.
Nice.
And then you buy your next pair of wish jeans.
We have the incredible networking event. It's not coming up soon, but I want to go ahead and mention it. It's going to be in October. I believe the date's going to be the 25th. I have to check with Mary on that. But
Yeah, right around my
Yeah.
birthday.
yeah, so it's going to be between the 21st and the 25th of October. I do know that much.
Well, I'll still make it. My birthday's on the 23rd. Even if
Okay.
it's my birthday, I will show up because
Yeah.
it is an incredible networking event.
Well, yeah, and then I hosted the last one with Celeste Supanzik. That was a lot of fun, and I actually won your prize for a second time. So that was really cool too. So I always enjoy the networking events, and this one was a lot better. I felt like I was more involved, I guess, doing things. So,
I just love that, we're so busy, especially as business owners.
yeah,
We're so busy working on our own business to be able to socialize and network with other businesses and talk to them and find out other businesses that have services. I mean, you and I get to do this once a week.
Yeah.
But for everyone else out there, we're busy in our businesses and not to know someone. And that's why it was so great today. I would not have known that she existed and that the services were available out there and that it was something that I, as a business owner, when I meet a lot of people, and then
Yeah.
also for myself, that it was out there. So
So you're listening to the Small Business Voice with Just Duncan and Jeanette Forney on Power Talk 1360 KFIV. So you actually got a employee from that event. Somebody saw you present,
exactly.
and she liked your personality type, I guess, enough to where she.
Her husband had a business, and so she figured that since he was a member of Gold Star, and she says, get a hold of her, ask her if I can come in for an interview and if she's hiring.
Yeah.
And so that's the whole thing. You also might be able to find other people that you can work with, network with. And he ended up contacting me and he says, my wife saw you at the event and she is an insurance agent and she would like to come in for an interview if possible and see if you would give her an opportunity to work for you.
Nice. Yeah.
And I hired her. She's great.
Yeah. And she's the eye. Yes.
Yeah, so she
Yeah.
is, for those of you that have been following along, we did a personality test, and the eyes, I guess they're influencers, they are great salespeople.
Yeah.
And she is a very strong I. So I got myself a strong salesperson that is an influencer. They really like reaching out to people and helping.
Well, see, and I learned something on mine, which you and Kurt would probably laugh at me. So I was a C, and which one were you again? Because I was the exact opposite.
Well, I am the DI, which is
That's right. So
that stands for what? Dictator, influencer. Yeah.
So I was an S and a C, and
which is cuddly and just sympathetic.
Cuddly and pathetic.
No, sympathetic. You know,
sympathetic.
Yeah, you
okay,
just
that's
care
good
about
save.
people. Mm-hmm. Yes.
So, but one thing I noticed is that it said my influencing and my convincing are down. Like it's like I have a hard time convincing people, and it was kind of funny because I'm thinking, man, that's true. I need to work on that better.
Mm-hmm.
And so it's kind of funny. It popped up in my personality test. So,
yeah, and that's why we make a great team.
Yeah, exactly. Because you bring people on, and I thank you for that.
You're thankful to have them, and you're so great and so gracious and everything else. And then I come in with the questions that I want to know.
Yeah.
And straightforward.
Yeah, straightforward. Yes. So, and we have more guests coming on too. Like like for some reason we were slow, and now it's like I have a waiting list for people that want to come on. So it's been.
Well, you see results too. Plus, you're
Yeah.
able to talk to so many people here in the Central Valley, and the feedback that I've also been getting, like especially today's show. I mean, I want to hear the feedback out there because this was incredible to find out that you could go somewhere and end up getting the medical care, be able to pay cash, nonprofit, and that they even have these payment plans. I'd much rather give it to a nonprofit, and if I don't use it, I don't lose it, and it goes to a great cause, and it's tax deductible, than throwing away my money to big pharma and big insurance companies that are playing doctor out there.
Exactly.
I mean, if you ever really saw my passion over friends that have died because they couldn't get tests because it wasn't approved by their insurance companies. I mean, I think that if we did a segment on it, there are so many stories out there of people that weren't able to get the medical care or being denied treatment. Let a doctor do their job.
They're gonna come back in September and October.
Okay, fabulous.
So we'll have them back on.
Now that's the kind of nonprofit I would like to support because I know they're doing some for the local community.
Absolutely.
Perfect.
Anyway, I want to thank everybody for tuning in each week. We look forward to having you back next week. A heartfelt shout out to our dedicated producer, Mike Murray, and the general manager of KCBP, Jim Costello, for their invaluable contributions to our show. Kurt Gonzalez from Lightspeed Graphics and Animation for capturing our inspiring guests and their stories. If you're seeking assistance with digital marketing, don't hesitate to reach out to Kurt at 209-617-2606 or via email at kurt@lightspeedgraphics.com. Thank you, Jeanette Forney, for joining me today and for your support of the Small Business Voice, and each week, by the way.
You're welcome.
And remember to join us every Saturday at 11 a.m. as we dive into the minds of local small business owners and even more insightful discussions. And a special thanks to our guest today, Dr. Erin Kiesel of St. Luke's Family Practice, for sharing their expertise with us. Now, let's take care of business.